Now the very latest on the flu epidemic. Emergency rooms across the country are at capacity, schools are closing, and at least 20 children have died. And the deadly flu season could be getting worse. RT's Trinity Chavez has the story.
Flu season is in full swing, and it's straining health systems all throughout the country. Already, this is the worst flu season in over a decade. The health community bracing for how it's going to deal with this increasingly deadly epidemic. Hospitals overwhelmed and waiting rooms overflowing with patients to the point where they have been setting up tents outside to deal with the surge in patients.
We have seen a rise in the number of patients that are seeking, services for symptoms of having the flu.
Schools have closed in San Antonio, Cleveland, and Oklahoma. One Texas school district had over 300 students and staff out sick this week, forced to cancel school as well. Alabama declaring a public health emergency, and in California, at least 42 people under the age of 65 have died from flu-related symptoms. And the flu continues to claim lives across the country. A 40-year-old mother and marathon runner from California, and a 21-year-old fitness fanatic from Pittsburgh. But the flu is especially deadly among children. At least 20 kids have died this season, and just this week the deadly virus claimed the lives of 2 third graders.
Influenza killed 650,000 people every year around the world.
And the death toll continues to soar, especially in European countries. In Scotland, another 21 have died, and 8 in Northern Ireland. And in England, almost 3 times as many people are dying of flu this winter compared to just last year. According to health officials in England, at least 120 people have died of flu-related symptoms since October. Many UK pharmacies are now facing new fears of a shortage of the flu vaccination.
Until very recently, people have been able to get the flu jab, but I think in the last couple of weeks places have started running out, and so we've noticed a surge in demand for that reason.
Yet current vaccinations have little effect on this year's strain.
It really is a scientific challenge of getting a vaccine that would induce a response against the part of influenza that doesn't change from year to year. Influenza is a relatively unique virus because it tends to mutate a lot.
We can never predict what dominating strain of virus will be the main cause of illness in coming influenza season, but we may try to guess based on data from the previous season, and also looking into how viruses are evolving.
And the World Health Organization urges the importance of readiness in the case of an influenza pandemic.
We are monitoring globally all the events. We are monitoring viruses. We are preparing composition of vaccines. We are working with manufacturers to be ready to produce vaccine, to develop and to produce vaccines once it will be needed.
Now, although experts say that finding a vaccine for the flu is not an easy task, with 3 months left of the current flu season, experts still say to get the flu shot because some protection is better than no protection. Reporting in New York, Trinity Chavez, RT.